So today, now we will have a discussion on the topic anatomy of the middle ear. So yesterday we were discussing about the anatomy of external ear. So now we will have a discussion on the anatomy of middle ear. Okay. So in the middle ear, what are the things we want to know in the middle ear? So in external ear, we said external ear is divided into three parts: the pinna, external antecanal, tympanic membrane, and then the sound passes inside the middle ear. Okay. So what we want to know inside the middle ear? See again. Middle ear is like a box shaped structure. It's like our room now. It is a box shaped structure. So we are dividing the middle ear into, say, assume that if this is our middle ear, a box shaped structure, we are dividing the middle ear into three parts: epitympanum, mesotympanum, hypotympanum. So we are dividing this into three parts: epi, meso, hypo. Epitympanum is the one above is the epitympanum. Mesotympanum, meso means middle, hypo means the floor. Okay, epi means crown, above. Meso is middle, hypo is floor. So we are dividing the middle ear into three parts: epitympanum, mesotympanum, hypotympanum. Okay, so of this, when we just see the pictures, see again, this is the middle ear. We are dividing the middle ear into epitympanum, mesotympanum, and hypotympanum. Okay, epi above, meso in the middle, and hypo is in the floor. Okay, now of which the dimensions of this epitympanum, mesotympanum, and hypotympanum is a very important MCQ. It has been asked multiple number of times. Have it in mind. Its dimension is around, it's not the same in the picture, it is around, we call it as 6, 2 and 4. Okay, so 6 millimeter, 2 millimeter and 4 millimeter. So the narrowest part of the middle ear is, which is the narrowest part of the middle ear? 6, 2 and 4. So the narrowest part of the middle ear is mesotympanum and the biggest is epitympanum. The very important MCQ, they will ask you which is the narrowest part of this middle ear. It is mesotympanum. Okay, so but which is the dangerous part? They will ask you the dangerous part of the middle ear. See, whichever is in the, so we know what is above the middle ear, what is above the ear. If this is the middle ear, what is there above the middle ear? We have our brain, dura mater. Okay, so anything which occurs in the superior aspect, any infection, it has a chance of directly going and involving the brain. So we call that any infection in this upper part of the middle ear, we call it as unsafe. We will discuss in the pathology chapter also, in the clinical case scenarios also, that is unsafe. Anything above, we call it as unsafe. Anything in the middle, we call it as safe. Okay, so we know that epitympanum is above. So any infections in the epitympanum can go and directly involve the brain. So we call it as a dangerous part. Okay, so two important MCQs. Which is the dangerous part of the middle ear? It is epitympanum. Which is the narrowest part of the middle ear? The narrowest is mesotympanum. A very, very important MCQ. Okay, so coming on to the boundaries of the middle ear, what are the things they will ask in the boundaries is, so we are dividing, as I said, middle ear is a box shaped structure. It's like a box. So how many walls are there in the box? Say we are in a room, we are sitting in a room, you are attending my class in this room. So now how many walls does this room has? You all know this has a roof, this has a floor, this has a medial wall, this has a lateral wall, and there will be anterior wall, and there will be posterior wall. So we know that the middle ear consists of 6 walls. 6 walls, there will be a roof, there will be a floor, there will be an anterior wall, there will be a posterior wall, and assume that there is a lateral wall and a medial wall. So there will be 6 boundaries for this medial wall of the middle ear. Okay, so of this, the roof, floor, not much important MCQ, but have it in mind. We'll just make some important MCQs here. Which forms the roof of the middle ear? So what is there above the middle ear? What is there above the middle ear? We have the middle cranial fossa. If this is the middle ear, we have a middle cranial fossa. So what is the boundary between the middle ear and the middle cranial fossa? We have a bone. We call that bone as a tegmen. Okay, so tegmen is the one, it is a bone which separates the middle ear from the middle cranial fossa. Tegmen, okay, that is a roof. Okay, the floor, coming on to the floor is the one which separates the middle ear from this. We have a jugular bulb here, we have a jugular foramen here. So this boundary separates the floor of the middle ear from the jugular foramen. Okay, the floor is nothing but it's a thin plate of bone which separates the hypotympanum, that is the floor of the base of the middle ear, from this jugular foramen. The jugular foramen will be here. Okay, it is nothing but a thin plate of bone. Floor not much important, just for understanding I am saying. So roof tegment, floor is a thin plate of bone which separates from the jugular bulb. Okay, and coming on to the next important boundary, a very very important one, the lateral wall. Which forms the lateral wall of the middle ear? Lateral wall of the middle ear. See, again we know that lateral wall is the entry point of the middle ear. Okay, so if I want to come inside the middle ear, I want to open up the lateral wall to come inside the middle ear. So which forms the lateral wall of the middle ear? It is the tympanic membrane. So tympanic membrane is like a door. If I want to go inside the middle ear, I need to open the door and go inside. Okay, the lateral wall of the middle ear, very important MCQ. Lateral wall of the middle ear is formed by tympanic membrane. Don't forget this, a very very important MCQ. Lateral wall is formed by the tympanic membrane. So which forms the lateral wall of the middle ear? The tympanic membrane, a very important MCQ. Okay, so we have done with the roof, we have done with the floor, we have done with the lateral wall. Okay, coming on to the next important MCQ, the medial wall of the middle ear, a very very important MCQ. Okay, so once we open the door, once we open the tympanic membrane and once we go inside the middle ear, we see the medial wall of the middle ear. So what are the MCQs they will ask us? What are the important structures or what are the important landmarks seen in the medial wall of the middle ear? A very important MCQ. Important MCQ. So when we just put a diagram of the medial wall, have it in mind, there will be a lot of things. Just have three things, important things in your mind. So we have, if this is the medial wall of the middle ear, the most prominent structure in the medial wall of the middle ear, we have a bulge in the medial wall of the middle ear. We call that as promontory. Okay, promontory. Promontory is nothing but a basal turn of cochlea. So we know that cochlea is a inner ear. Okay, what happens? The basal turn of cochlea comes as a projection and it presents as a bulge in the medial wall of the middle ear, and that is what we see from the inside. Okay, the most prominent structure seen in the medial wall of the middle ear is the promontory. Don't forget this, a very important one. Promontory is nothing but a basal turn of cochlea. And coming on to the next one, apart from the promontory, we have two other important structures. We have two windows. We have two windows in the middle ear, medial wall of the middle ear. One will be oval in shape, other will be round in shape. Okay, so we have two windows. One is the oval window, other is round window. Okay, have it in mind. Why are these windows? Why should we have a window? So these windows are like our ventilation tracts. Okay, so what happens now? Say for a sound to get conducted, the sound goes inside the inner ear and it vibrates the oval window and goes inside the inner ear and comes and it blocks the round window, so that the vibration happens in the inner ear. Okay, so this will be, we will discuss in the physiology chapter also. Have it in mind, this oval window will be closed by foot plate of Stapes. So there will be Stapes here. Okay, the foot plate of Stapes closes the oval window. Okay, round window is closed by, again here round window is closed by a mucosal fold over the round window. We call it as secondary tympanic membrane. Okay, secondary tympanic membrane. Okay, so now why are these oval window and round window being closed, apart from why it should not be open? So as I said, so whatever the sound we hear, it travels through our pinna, and we discussed yesterday, it travels through the external atrial canal, it travels through the tympanic membrane, and the tympanic membrane vibrates. Once the tympanic membrane vibrates, the sound travels through the middle ear, and in the middle ear we will be discussing about ossicles also. We have three ossicles, the Malleus, Incus and Stapes. We will discuss this again also. And this Stapes will go and lie over a window. We call that as the oval window. The Stapes lies over the oval window, and now the sound gets transmitted to the inner ear. Okay, and the round window will be here. So now if the round window is open, what will happen? the vibrations goes like this and it will come out. So the round window has to be closed. So now what happens here is the round window is closed by a mucosal fold. We call that as secondary tympanic membrane. Secondary tympanic membrane. It is not a tympanic membrane, it is an artificial mucosal fold which closes the round window. Okay, so through this the sound gets transmitted to the inner ear and there runs the eighth nerve and we are able to hear the sound. Okay, so this is the mechanism of hearing. I will repeat this back in the physiology chapter also. Okay, so now we have two windows, oval window, round window. We have discussed about the promontory, we have discussed about the windows, the oval window and the round window. And coming on to the next point, the processus cochleariformis. So this is somewhat a new word for you, but a very important MCQ. Processus cochleariformis. Okay, this is nothing but a, say in our middle ear, in the medial wall of the middle ear, we have a small twig of bone. You have a small bone. This bone is called as processus cochleariformis. Why it is important is, this processus cochleariformis, the muscle, we have two muscles in the middle ear, the tensor tympani and stapedius. We will discuss it later. The muscle comes from this middle ear, it makes a turn over the processus cochleariformis and gets attached over the malleus. Okay, just have this name with you, the processus cochleariformis. So the three things which are important in the anatomy of the medial wall of the middle ear is, one is the promontory, there are two windows, and the next one, as I said, the word of processus cochleariformis. Okay, so we have discussed about the lateral wall, the roof, the floor, the medial wall. Okay, and we have left with two more important walls. One is the anterior wall, other is the posterior wall. Okay, in the anterior wall, have it in mind for your exams, have it in mind, there are three openings in the anterior wall. Don't get confused a lot. There are three openings in the anterior wall, which is very, very important, which is a repeated MCQ also. There are three openings. Okay, assume that this is the anterior wall. The first one is for opening for Eustachian tube. The second one, there is an opening for tensor tympani muscle. The third one, there is a small opening for the exit of cauda tympanic nerve. Cauda tympanic nerve, which is a branch of facial nerve. Okay, so there are three openings in the anterior wall of the middle ear. One is the opening for Eustachian tube, the second is for the tensor tympani muscle, and the third is for the exit of cauda tympanic nerve. Okay, they will ask you, all of the following are seen in the anterior wall of the middle ear except, or they may ask you, which of the following is seen in the anterior wall of the middle ear. Okay, so this is how they are framing MCQs. Okay, so this was a recent MCQ also. They have asked about all of the following are seen in the anterior wall of the middle ear except, and they gave an option as the promontory in the anterior wall. Promontory seen in the medial wall, it's not seen in the anterior wall. Okay, so and coming on to the next wall, don't forget this anterior wall. Coming on to the next one, the posterior wall. Again, the posterior wall is, what is there behind the posterior wall? We have a mastoid process. Okay, so the middle ear consists of not only the middle ear, it consists also the mastoid process also. The posterior wall is formed by this mastoid prominence. Okay, now these are the basic things which you want to know in the middle ear part is concerned. So we have discussed our roof, floor, anterior wall, posterior wall, medial wall and the lateral wall. Okay, so coming on to few other important MCQs which have been asked recently, have it in mind, in the medial wall, we were discussing about the word of processus cochleariformis, the promontory, the windows. And there is one more important word in this medial wall of the middle ear, the word of sinus tympani and the facial recess. I will just put on a word here once again. The word sinus tympani is seen in the medial wall of the middle ear. It is nothing but, say, this is a picture of your medial wall of the middle ear. As we said, this will be the promontory, this will be the processus cochleariformis, and this will be the round, here there will be windows there, the oval window and round window will be here, which is not seen in the picture. And in between the oval window and round window, if this is the oval window and this is the round window, between the oval window and round window, there will be a dip, there will be a small depression between this wall window and round window. We call that as a sinus. Sinus means a dip. Okay, we call that area as a sinus tympani. A very, very important MCQ, sinus tympani. So this area is the sinus tympani. Okay, so sinus tympani is nothing but this is the area between the oval window and round window. There will be a dip. We call it as sinus tympani. A very important MCQ, sinus tympani. It is seen in which wall of the middle ear? It is seen in the medial wall of the middle ear. Okay, and the next MCQ what they will ask here is, it is seen in which space? That is epitympanum or mesotympanum or hypotympanum. It is seen in the mesotympanum, not in the epi, not in the hypo. So sinus tympani, it is a mesotympanic space seen in the medial wall of the middle ear. Okay, and the boundaries of sinus tympani, I will give you two important new words here. One is called as the ponticulus, the other is subiculum. Okay, the sinus tympani is bounded by two boundaries. One is the ponticulus above and the other is subiculum below. Okay, so this sinus tympani is a hidden area. It lies between these two areas. It is a hidden area. So what happens here is, while doing a surgery, we may miss out this area while doing a surgery. So this is also called as a site of hidden cholesteatoma. A site of hidden cholesteatoma or a residual cholesteatoma. This is sinus tympani. A very important MCQ. It is a mesotympanic space, not a hypotympanic. It is a mesotympanic space. It is seen in the medial wall of the middle ear, medial to the facial nerve, and it is a site of hidden cholesteatoma or a residual cholesteatoma. Okay, so coming on to the next important space, the facial recess. Facial recess is nothing but, say, when I go to the picture, say if this is the facial nerve, this is the facial nerve. We will discuss the anatomy of facial nerve in a separate chapter. This is the facial nerve. Just lateral to the facial nerve, in the posterior wall, lateral to the facial nerve, here there lies a space, we call that as facial recess. Okay, the facial recess lies lateral to the facial nerve. Okay, it lies in this posterior wall of the middle ear. Again, this is a mesotympanic space. This is seen in the mesotympanum. Okay, it lies lateral to the facial nerve. The importance of facial recess is, as I have put in the picture, the facial recess, very important one. It is a site of surgery for cochlear implant. They will ask you, cochlear implant is done through which approach? It is a facial recess approach. That means, if I drill in this facial recess area, I am entering inside the cochlea for doing a cochlear implant. Don't forget this word, even if you don't understand much important points, the boundaries and all, have this in mind. Facial recess is a procedure done for cochlear implant. The approach is facial recess approach. It is seen in the mesotympanic space. It lies lateral to the facial nerve. Lateral to the facial nerve, seen in the posterior wall of the middle ear. Okay, these two words very important in the anatomy. The medial wall, which discuss about the sinus tympani, and the other is a facial recess, which lies in the mesotympanic space, lateral to the facial nerve. Okay, so coming on to the other structures which are important in the middle ear. In the middle ear, see, again we have discussed the anatomy. The middle ear also contains 3 ossicles, 2 joints and 2 muscles, which we need to understand before we finish our anatomy chapters. Okay, so there are 3 ossicles. As we discussed from the morning, we have 3 ossicles. One is the Malleus, the other is Incus, the third one is Stapes. Okay, Malleus, Incus, Stapes. So we have 3 bones. So the Malleus will be, assume that the Malleus will be like this. Okay, so this is the Malleus, this will be the Incus, and this will be the Stapes. Okay, so the Malleus, Incus, Stapes. The Malleus will consist of a head, neck and the handle of Malleus. We know that the handle of Malleus, and there will be 2 processes. One will be the lateral process, one will be the anterior process. That's not much important. They have this alone in mind. They won't ask in much complicated and all. Have it in mind, we have a head, neck, handle of Malleus. And in the Incus, we have a body of Incus, we have a short process, we have a long process, and the turn we call it as lenticular process. So we have a body, short process, long process, and a lenticular process. And now this lenticular process joins with the stapes, and this is a stapes. We call this as a stapes suprastructure. Okay, and this will be the foot plate of stapes. Okay, so we have three ossicles: the Malleus, Incus, Stapes. The Malleus is a head, neck, handle, and there are two processes. Okay, and the Incus, body, short process, long process, lenticular process, and then communicates with the Stapes. The Stapes has a suprastructure, and this will be the footplate of Stapes. And we know that the footplate of Stapes will lie over which window? As we discussed, it lies over the oval window. Okay, so these are the three ossicles. So what is the important MCQ they will ask here is, which is the biggest ossicle of these three? The biggest ossicle is Incus. The Incus is biggest. Incus is big. Okay, the smallest is Stapes. Stapes is smallest. Okay, don't forget this. The biggest is Incus, the Stapes is the smallest one. Okay, so the next MCQ, what they will ask here is, so we said 3 bones. So 3 bones means how many joints will be there? So there will be 2 joints. Okay, one will be the incudo-malleal joint. Between the Malleus and the Incus, we have a joint, we call it as incudo-malleal joint, that is IM joint. Okay, and the second one, between the Incus and the Stapes, we have a joint which is called as incudo-stapedial joint. Okay, so we have 2 joints. One is the incudo-malleal joint between the Malleus and the Incus. Other is the incudo-stapedial joint between the Incus and the Stapes. Okay, now what are the MCQs they will ask here is, so what type of joint is this? Okay, they are a type of synovial joint. Have it in mind, the incudo-malleal joint is a saddle type of synovial joint. Saddle type of synovial joint. Okay, incudo-stapedial joint is a very important MCQ. They won't ask about incudo-malleal, they will ask about incudo-stapedial. It's a very important MCQ. This is see, Incus, if it is like this, the Stapes will be like this. It will be moving the Stapes like this. So this is a kind of ball and socket type of synovial joint. Ball and socket type of synovial joint. Okay, very important MCQ. What type of joint is this? This is a ball and socket type of, again, this is a synovial joint. So both are synovial joints. That is a saddle type of synovial joint. This is a ball and socket type of synovial joint. Okay, so these are the things they will ask in the joints and the ossicles is concerned. So as we discussed, the joints and the smallest bone is the Stapes. And one more important MCQ which has been asked recently is, what are the ossicles seen in the epitympanum area? Okay, epitympanum is above. Okay, so when we just see this picture, when we see our picture, the first picture what we discussed, see again what are the ossicles we can see. This is the epitympanum. What are the ossicles we can see in the epitympanum? We have a head of the Malleus, we have a neck of the Malleus, not the handle. The handle is in the mesotympanum. The same picture what I drew now. Okay, head, neck, and we have a body of Incus, short process of Incus. The long process is here, but the lenticular process is in the mesotympanum. The Stapes is in the mesotympanum. Is it clear? Is it clear? The Stapes is purely in the mesotympanum, not in the epitympanum. Okay, what they have asked recently is, all of the following are seen in the epitympanum except, and they have asked option A, handle of Malleus, option B, the head of the Malleus, option C, the body of Incus, option D, short process of Incus. So of this we know that the handle of Malleus lies in the mesotympanum, not in the epitympanum. So Just imagine this picture. When they ask this MCQ, just imagine this picture. What are the structures? What are the same image what we do now? Okay, head, neck, body of incus, short process of incus, and the long process of incus. This all lies in the epitympanum. Okay, clear with this? Clear with this? So this is regarding our bones is concerned. Okay, and one more thing, the next one, the muscles. So there are two muscles which we want to discuss. There are two muscles in the middle ear. One is the stapedius muscle. The other is tensor tympani muscle. Okay, have it in mind. The name stapedius. So where it is attached? Stapedius. What bone is there? Stapes. Okay, the stapedius is attached to the neck of stapes. Okay, the tensor tympani muscle will be attached over the malleus, neck of the malleus. Okay, so we will start with the stapedius. Again, the nerve supply of the stapedius is by the nerve supply is from nerve to stapedius, which is a branch of facial nerve. So the nerve supply is from 7th nerve. Okay, for tensor tympani, see again, all tensors are supplied by mandibular division of trigeminal nerve 5-3. Okay, all tensors, it could be tensor tympani or the tensor vale palatine, whatever we will discuss later. All tensors are supplied by the first arch nerve, that is the mandibular division of trigeminal nerve. Okay, so now we will go in depth about each muscle. So we have discussed about the important points: the stapedius, the tensor tympani. Stapedius is attached to the stapes, tensor tympani is attached to the malleus. So what is the function of our stapedius? The function of stapedius, what does it do? Say again, say if we are sitting in a classroom, if there is a huge bomb explosion near us, a sudden cracked sound near us, but still our hearing is getting protected. Still we are able to hear. So which muscle is involved in that? The stapedius muscle. So what happens here is, the stapedius is attached to the stapes. The stapedius will be attached to the stapes like this. Say if this is the stapes, this is the stapes. Stapes attached to the wall window. The stapedius muscle will be like running like this. Okay, this is the stapedius muscle, will be attached to the neck of the stapes. So what happens now? When our brain suspects a high sound, when we suspect a high sound, the stapedius will pull the stapes just out of the way, so that the sound never gets transmitted through this area, goes inside the inner ear. It never goes inside the inner ear. In that way, our inner ear is protected. Okay, the main function of the stapedius muscle is dampening the sound. Don't forget this, reducing the sound, dampening the sound. Main function of the stapedius is dampening the sound. Okay, so if your stapedius, say again, if your stapedius is not working, if our stapedius is not working, so how will we hear a sound? We will hear even a normal sound like that of a high pitched sound, right? So we call that condition as hyperacusis. Hyperacusis means increased volume of sound. A normal sound will appear like a high pitched sound. That is called as hyperacusis. A very important MCQ, very important MCQ. Hyperacusis is because of which muscle involvement? It is because of the stapedius muscle involvement, right? Or they may ask you, hyperacusis is because of which nerve palsy? It is because of the 7th nerve involvement. Is it clear? Or nowadays, as we understand, they are asking clinical MCQ. They may ask you, a 30-year-old male presented in your OPD, he comes with the complaints of, he is able to hear high pitched sound. He is feeling that a normal sound is appearing like a high pitched sound. Okay, that means they are asking about hyperacusis. So which muscle is involved in this? The muscle is stapedius muscle. Okay, or they may ask you, a patient following Diwali bursted some crackers, the crackers following a huge explosion of cracker sound. He came to OP for ENT checkup, but still his hearing is normal. which muscle could have saved his hearing? It is the stapedius muscle. Okay, the stapedius muscle dampens the sound. Okay, dampens the sound. Okay, don't forget this, the word of hyperacusis and the nerve supply of the stapedius, very, very important, very important. Okay, clear with this? Okay, so coming on to the next muscle, the tensor tympani. Okay, tensor tympani, the function of tensor tympani is not much important. It is called as non-acoustic reflex. Non-acoustic reflex is nothing but say when we chew or when we do some muscle movement in the neck, we will feel some crackling sound in the ear. Okay, so this crackle sound because of the joints is conducted through this tensor tympani muscle. We call that as non-acoustic reflex. Non-acoustic reflex is nothing but a crackle sound, and that is through this tensor tympani muscle. So the non-acoustic reflex is through this tensor tympani muscle. The tensor tympani muscle is otherwise called as Toynbee muscle. That is a MCQ which is called as Toynbee muscle. Okay, and now as we discussed, the tensor tympani muscle will be coming and attached to the processus cochleariformis, and it will be, as we discussed in the previous slide, it will be running over the processus cochleariformis, and it makes a turn and gets attached to the neck of the malleus. Okay, so two muscles, not much important with the tensor tympani. The main important thing what they will ask is the stapedius. They have asked lot of direct MCQs. Nowadays the clinical MCQs is targeted towards the stapedius muscle. Okay, so this is regarding the muscles in the middle ear. So as we discussed, we have a stapedius, we have a tensor tympani, we have discussed about the nerve supply. And coming on to the posterior wall of the middle ear, we were discussing about the posterior wall, that is the mastoid process. In the mastoid process, have it in mind, we need to have in mind two triangles. One is the most commonly as repeated MCQ, the McEwan's triangle. Okay, see again this mastoid process, this contains lot of air cells, it contains many air cells, of which the biggest air cell is called as mastoid antrum. Okay, this contains lot of air cells, of which the biggest air cell is called as mastoid antrum. It will be something like a honeycomb appearance, of which the biggest one is the mastoid antrum. So while doing a surgery for mastoid, that is mastoidectomy, we want to approach that mastoid antrum. So what they will ask you here is, what is the surgical landmark for approach to the mastoid antrum? That is, while doing a surgery, I want to approach the mastoid antrum. What is the landmark? What is the surgical landmark for approach to the mastoid antrum? Okay, the surgical landmark, the triangle is called as McEwan's triangle, a very, very important MCQ. McEwan's triangle is the surgical landmark for approaching the mastoid antrum. That means, if I am opening or if I am drilling in this McEwan's triangle, I am into the mastoid antrum. Okay, so what are the boundaries of McEwan's triangle? A very important MCQ. Which of the following are boundaries of McEwan's triangle except? Okay, see, even if you don't remember this, just touch your mastoid area and see, this is our ear, behind the ear, this is our mastoid prominence. Okay, McEwan's triangle is this area, behind the mastoid process. Sorry, behind the ear, this mastoid process area. So what are we doing is, we are drawing a line A. Line A is just above like this, where the temporalis muscles will come and get attached. This is line A. Line B is in the posterior part of the external artery canal. This external artery canal, the posterior surface of the external artery canal, this is line B. Line C is a tangential line connecting this line A and line B. Okay, so we have three lines. The line A is the area where this temporalis muscle will come and get attached. The line B is along the posterior part of the external artery canal. The line C is a tangential. Tangential line means a perpendicular line connecting line A and line B. When I drill in this area, I am into the mastoid antrum. So just know the name. The triangle is called as McEwan's triangle, a very important landmark, and this is the surgical landmark for mastoid antrum, a repeated MCQ. Okay, so line A is the suprameatal line, where the suprameatal line where the temporalis muscle will come and get attached. Line B is along the posterior wall of external artery canal. Line C is a tangential line connecting these two lines. Okay, This is McEwen's triangle. Don't forget this, the surgical landmark for approach to mastoid antrum. And we have one more triangle, we call it as Trotmans Triangle. Have it in mind, the boundaries are not important in this. Have it in mind, in the Trotmans Triangle, that is after doing a mastoidectomy, we find a weak spot in the posterior wall of the mastoid through which infections from the mastoid process can go up to the cerebellum, creating a brain abscess. See again, the most common abscess is the cerebellar abscess. Okay. So what happens here is the infections from the mastoid can go up to the cerebellum, producing a cerebellar abscess. So they will ask you which triangle or which is the site of infection from the mastoid to spread into the cerebellum. The triangle is called as Trotmans Triangle. Just have the name with you. Trotmans Triangle is through which the infection from the mastoid go into the cerebellum. Okay. And one more thing of importance in the mastoid is there will be one developmental abnormality. We call it as Carnos septum. Carnos septum is nothing but, say, while doing a mastoidectomy, we think that we have approached the mastoid antrum, but we won't have approached the mastoid antrum. That will be just a pneumatization over that area. So, very important one, Carnos septum is nothing but, we know that the mastoid process is formed by the squamous part and the petrous part will come in contact and forms the mastoid process. What happens? There will be a suture line, a petrosquamous suture line, which will disappear while in utero stage, it will usually disappear. Okay, but what happens if there is a persistent of this petrous and squamous suture line? It will appear as a separate air cells. We think that we have approached the mastoid antrum, but we haven't approached. That is called as Carnos septum. So Carnos septum is nothing but it is a persistence of petrosquamous suture line. Okay, so this will mimic like a mastoid antrum. So while doing mastoidectomy, this is of more significance. Okay, this may mimic like a mastoid antrum. Okay, that is Carnos septum. Carnos septum is seen in which part? It is not seen, septum is not seen in the nose. It is seen in our mastoid area. It is nothing but a persistence of petrosquamous suture line. Clear with this? Any doubts in this? Okay. So now we have come to the end of our anatomy of the middle ear session. So in the next chapter, we will go with the anatomy of inner ear. Thank you.